So you are preventing tooth loss, ending gum disease with an oral DNA test. Tell me about it.
Okay, so here's how this works, Randy. If a patient comes to me and we do the examination, I inform them ahead of time. If there's pocketing, which means that the gum has pulled away from the tooth, the bone has started to evaporate because the bacteria is eating the bone up.
Like, what are the symptoms, by the way, of gum disease?
So symptoms are bleeding gums. Okay, when they brush, there's blood. When they
little
spit,
bit of blood's okay though.
Well, it's not okay. It's not bleeding. Our goal in my office is zero bleeding. Every time they come in for cleaning, I tell my patients we want zero bleeding. So that kind of, I'll say motivates them to do what they should be doing at home. I don't say it's just flossing, there's water picking, there's a lot of things involved with this. So, when they come in, and if they're a new patient, okay, so now we check their gums and there's bleeding, there's lots of bleeding, and there's pocketing. I will tell them, I want to do an oral DNA test. What does it do? It tells us the specific bugs that are causing your problem, that are causing you to have inflammation in your mouth, and not only in your mouth, it's traveling systemically.
Okay.
And it's well known that this bacteria is contributing to heart disease and strokes. So we want to get this patient healthy, not only here, but all over their body. So the test will show us specific bugs that are in there.
So you get about, I've seen your graph. So you send out to the lab, comes back, and it shows you the different
there's high
bugs
levels
they have in their mouth.
Yes, there's high risk bugs, there's medium risk bugs, and low risk bugs. So our goal again is to eliminate those bugs, suppress them, or just completely get rid of them. So there's a whole protocol to do that. And once we do that, 7 weeks later after they've gone through this protocol, we retest them. They come in, we check for bleeding. There's zero bleeding, Randy. If they do what we ask them to do,
bad breath goes away?
Zero bleeding. Bad breath is gone because the bacteria is gone. Then we retest. We do another oral DNA at no charge, and it comes back, and we look at the before and the after. And I think you have graphs on that I provided.
Yeah.
So it's an amazing thing that now we can show the patient that it worked. When you don't do it this way and you just blindly go in there and you start scraping and you need a deep cleaning, okay? So those things are not predictable. You're not getting the bacteria out from the gum and out from the bone. They're still there. So
these people, you were telling me in our green room, you were saying, in dentistry, I'm paraphrasing, giving me the inside scoop, but people with bacterial infections in their mouth, gum disease, they're just every 3 months on this treadmill of deep cleaning, deep cleaning.
See, what happens is, Randy,
but you don't like that.
I don't like that. It's just that, I'm getting upset right now. So,
don't lose your temper. We'll try not to lose your temper.
Okay. So what it is, they're cleaning, but you're scraping a tooth, but the bacteria, it's still there. They're little bugs all over, so you're just kind of moving them around, scraping them. You have to kill those bacteria, and there's a special way to do that. There's certain things you squirt underneath the gum. There's a whole protocol. So that has to be taken care of. You can't blame the patient, Randy. You can't have the patient come in and say, whoa, you're bleeding again. The pockets are still there. You're not flossing. No, come on. Times have changed. It's not the old school 70s, 80s, model of gum
But there's
disease.
only 1% of the dentists that are even doing this. So this kind of testing, is that true?
That is true because, unfortunately, 90% of the dentists out there, Randy, do not go to higher level education. They just sit there and what they learn in dental school, they just keep going. They have a busy practice.
And that's okay for them,
I guess. I mean, it works.
But that's not you.
That's not me. I am driven and I want to know how to take care of my patients the best way. I want to do my dentistry one time, and the rest of your life, I want you to come in only for cleanings. I don't want you to get any more cavities. I don't want you to have any more bleeding gums. That is my goal in my practice.
Now, the gum disease guys are the periodontists. And
Yes.
I had a well-known periodontist on my show. He said, Randy, if the general dentist figured this out, we'd be without a job. because you wouldn't really lose teeth if you're doing the oral DNA testing he said, because by the time they get to us, the periodontist, they're in bad shape.
Yes.
If general dentists would do this, it's better for the patient.
Oh, definitely.
So you believe that?
I definitely believe that. I mean, you have to know what's causing. You don't want to just, I'll give you an example. Somebody comes in with a cavity, right? Okay, cavity. We're not talking gum disease anymore. What caused that cavity? Bacteria. It's not, I ate too much sugar. I eat a lot of candy. If you don't have that bacteria in your mouth to eat that sugar and that food, you'll never get a cavity.
This is interesting.
So hypothetically, if you had no cavity causing bacteria in your mouth, you would never get a cavity, no matter what you ate. So now, somebody comes in with cavities.
This is good.
Somebody comes in with cavities now, right, Randy?
I'm at the edge of my seat, by the way, over here.
So here's what we do. Okay, are we gonna just patch it and fill it and say, okay, we're done. Or if there's a bunch of cavities, we say, okay, the typical practice, they'll go home and come back, and maybe in a year or two later, there's more cavities. I don't want that to happen. I want them to lower that bacteria in their mouth that causes cavities. I want to lower it, eliminate it, so they have no more cavities. So there's special protocols to do that.
Okay.
And that's the higher level of training.
I'm not trying to side with you on this show, but this is not something I hear dentists talk about.
That's why, as I said earlier, 90% of the dentists do not know these things.
But this is like the newest, hottest trend.
This trend has been around for a while. It's just, if you don't go to seek out that knowledge to learn it,
So of the 30 million people, I'll put you on the spot here, 30 million people are wearing dentures,
correct,
according to Google. Mm-hmm. And do you think if you could have got these people early with targeted oral DNA testing that's not expensive, killed the bad bugs,
for sure,
they wouldn't have lost their teeth?
For sure. So that's why this, technology is so important. Now you have the tools to help somebody in a different way. You don't just watch it dissolve and say, you know what, we're going to have to take out your teeth now and do dentures. You're at some stage where you're starting to get the disease, right? And it's at the beginning stage. If you catch it at that level and you're able to teach the patient, to guide the patient, to coach the patient on what to do at home and get the right treatment, they will keep their teeth.
Okay, because losing teeth is very expensive.
Very expensive.
And we should mention, you also do dental implants, so when you can't save certain teeth, you may have to extract them, give them a new tooth supported by dental implant.
That's correct. So we do that in our office.
Okay.
It's when they're at that level, that's what it calls for. You have to do that treatment in order to get the patient teeth. But you're right. If we caught them earlier, could we eliminate that bacterial infection in their mouth and taking care of them in the proper way so they don't lose their teeth? Yes. That's the whole goal.
Do you tell your buddies that are dentists that don't do this? Do you tell them, like when you're at meetings, you got to do this? Do you?
So I'll tell you another story if we have time here. When in 2006, I bought my practice, okay? And again, I'm in the North Shore. My idea of the North Shore was everybody's doing what I'm doing. They're at their A game, right?
Because it's an affluent area.
It's an affluent area.
Okay.
So, I'm thinking CEOs and whatever, they're all being treated top level. So I go to this meeting at a periodontist office. Periodontists want to get to know me,
yeah,
so you can get referrals from me.
Yeah.
I didn't know anybody in the area, so I go to this meeting, right? So here we are, 30 people, dentists. I'm getting to know some people. There's some pizza, there's some salad, whatever. We're having some small talk. Hey, what kind of impression material you use? What kind of binding system? Right, these little dental things that we talk about, right? So I get excited, like, what have you guys done? What have you learned? Who have you seen? And I waited. And do you hear that silence right now?
Yeah.
That's what it was. I went, uh-oh. And so one guy says, well, I heard this guy. Well, the guy he mentioned was basically the Consumer Reports guy who teaches you which are the better products to use in dentistry, not how to do a full mouth rehab. So I felt embarrassed when he asked me, what have you done? And I started listing out the things that I have learned and the people I've learned from.
So not a lot of guys doing what you're doing in the North Shore.
They don't. There's a select few.
So that's good news for you.
Yes.